Hey everybody, my name is Eric Vranish with a long hair that needs a haircut. I'm a physical therapist. I enjoy running a lot and I enjoy serving the running community. And I mentioned earlier today that I'd be doing Facebook Live on medial knee pain. There's a guy that mentioned something in a group and he had a pretty good pain on the inside of his knee. And sometimes the right information just isn't out there. And so I give you guys, as much as I can, I give you guys some tips and strategies for whether it's medial knee pain, which is on the inside of your knee where your knees kind of meet together when you're standing. Medial meaning kind of midline between the knees. And it's just something that I really think is valuable. So anyway, my name is Eric Vranish. I'm a physical therapist. Like I said, I enjoy this stuff. And if you guys got any questions or comments, go ahead and leave them below. Anyway, so medial knee pain on the inside of the knee generally comes down to three structures most of the time. It's the MCL, your medial meniscus, which most of the time is more rare than what we think. It happens, but it's not as big of a deal most of the time, even though it feels pretty bad sometimes. And a lot of times, in my opinion, that ends up being the saphenous nerve. It's a branch off of your femoral nerve, and I see it a lot. Anyhow, if you guys are on, comment live. If you guys are on replay, comment replay so I can just see who's here. We can just dialogue a little bit if you like. Leave your questions, comments below too. Anyway, though, so I think today we'll talk about the saphenous nerve because I see it a lot in the clinic. A lot of people think that it's the meniscus because it's really painful. And it ends up being a big pain point often enough, the saphenous nerve. It masks as a number of things on the inside of the knee. Sometimes it masks or makes it seem like we have this pezanserine tendinitis or this pezanserine bursitis. Not saying that doesn't happen, but if you've ever seen a bursitis, it is huge. It is a big ball, maybe sitting at the end of your elbow, or a big ball at the end of your knee. It's not something that's easily missed. If you're diagnosed with pezanserine bursitis, it tends to be pretty big, and let me just show you if we can do this right. So anyway, pezanserine bursitis tends to be just below your knee, at least the diagnosis, right? And I'll put it in quotes. And pezanserine tendinitis will tend to be right here. And I'll put that in quotes too. Not that both of them never happen, but it's generally more rare I see in the clinic than it's actually diagnosed or labeled that way. Often enough, it is the saphenous nerve. And a lot of times these people end up having, in the past, they might have had hip pain or sciatica kind of issues, or maybe on and off low back pain. Not all the time, but sometimes it just kind of keys up the nervous system a little bit to bring on some pain on the inside of the knee. Anyway, so we'll talk about MCL later on this week and meniscus and stuff like that. But anyways, we're going to key up today on the saphenous nerve. And sometimes it can be awful. And a lot of times the MRI is negative or not very clear on what the pain point could be. Doctors kind of look at you kind of funny. They may not know exactly what's going on, or they're kind of, not quite sure exactly how to describe what's going on to you. Often enough, it ends up being the delay in getting to somebody early enough. And the nervous system, when you just keep on running, it'll tend to stay sore too. Can a bruise develop and stay there from it? Normally when it's a bruise, thanks for the question, Juan. Normally when it's a bruise, I mean, it'll be black and blue. It normally won't stay there, no. Depending on how long you mean, how long has it been staying there? I mean, it's, unless there's, constant kind of pressure on that area. Sometimes people that wear a pretty solid kind of a neoprene brace with those metal kind of inlays will put enough, if they make it tight enough around their knee, it'll cause that. And it'll be bruised, but for a bruise to stay there, no, not unless there's, some pressure on the area over time and stays there. It's not going to stay there. I've never seen that in a bruise. I mean, it'll be bruisey, it'll be either black, blue, or at least start to look black and blue, and then maybe as it tails off, kind of green or yellow. And then it'll go back to like nothing in about, maybe 3-4 weeks at the longest. It won't, a bruise won't last, unless you've had surgery, a bruise won't last more than, a couple weeks or so. 3 and 4 may be a bad bruise, but then that's when we're talking about, at least a surgery of some sort. Just want to say hey to Chris and Luis and Anz and then Lynn. Lynn, I think I've seen your name before. Anz and then Lynn? Hey. And Marcia, thanks for coming on. So yeah, and generally the stuff that tends to hang around, now we can talk about MCL. The MCL, I don't want to get into that too much, but generally the MCL is from a foot that flattens out too much, or a knee that kind of comes in just a little bit stride after stride. And there's a way to kind of look at that, but we'll get to that later on this week and talk about the MCL. But the saphenous nerve ends up masking as a lot of knee pain. And that's when people just start looking at you kind of funny. Anyway, so let me talk to you about it a little bit more. So how you can kind of self-diagnose a little bit, or at least self-assess. You see where the pressure is. So anywhere along the inside of the knee, if you look up the saphenous nerve, and I wish I had a picture up, I don't have it right now, but saphenous, saphenous nerve. And if you look that up, it's a branch that comes off your femoral nerve, that innervates your quads, and it goes down the inside of your thigh, inside of your knee, and actually goes all the way down to the bottom of your ankle. But anyways, it masks as a lot of things on the inside of your knee because it actually sends up little kind of nervy kind of things going this way, right around the inside and over the top of your kneecap sometimes above your knee and sometimes slightly below your knee at your tendon. Chris, how do you spell the name of the nerve? Yeah, so saphenous, saphenous, saphenous nerve. And it masks as a lot of knee pain problems. The stuff that won't go away, the stuff that you've been treated for maybe, and never quite goes away often enough is this kind of stuff. It's the saphenous nerve. So anyways, what you can do, there's a little pit right around the inside, this big portion called your VMO of your quad, your vastus medialis oblique. There's a little bit of a divot right here just before your hamstring group, and you can kind of push there. And if you press there for maybe 10, 15, maybe 20 seconds, over time, you'll get this bleeding kind of a light ache or dullness into the inside of the knee right in here. And if you generally have pain on the inside of your knee, but just below your knee, what I would do is where your pain point is, just maybe an inch or two below that, put pressure with your thumb right here, same thing, maybe 15, 20 seconds. And generally it'll start to kind of bleed up into this area. It kind of go up into your knee just a little bit and give you a sense of, well, I'm pressing way below it and it's giving me knee pain here. So wherever your pain point is in your knee, whether it's just right at your knee, just above or just below on the inside of your knee, maybe put your finger maybe an inch or two below your pain point, put pressure on it, leave it there. Leave it there for maybe 15, 20 seconds, depending on how irritable the area is. If it's been irritated for quite some time, it won't take long. But if it's kind of like this on and off, not quite sure, you feel it every now and then, you're not sure why, you might take like maybe more like 20 seconds or so. Just keep pressure on there. And over time, if it's a saphenous nerve, generally, it'll end up irritating just above it or just below it often. And I see this a lot in the clinic. So that's a really neat kind of a little self-assessment, kind of a gauge. Carl, Graham, and Ethan, good to see you, bro. How you doing, man? Anyways, another thing that's interesting, nerves like movement to a point. So that might be why, at least initially when you start running, it may not feel that great, but as the miles kind of kick in, it feels maybe a little bit better, but at the end it feels awful. Sometimes that's the nerve. So nerves like movement to a point, not aggressively, but they like movement to a point. They like blood supply, which is exercise and movement, and heat. So that movement, blood supply, heat gives them a little more blood supply. Movement, blood supply, space, and slack. They like space and slack. So they like, whenever you can give them space, whenever you give them slack, they tend to feel a little bit better. So just give you guys sometimes it's a real quick kind of a, almost a diagnostic tool. I put some of this on you, Ethan, you remember this stuff. Anyway, so it's rock tape, or you could use, kinesio tape, you can use KT tape, you can use, TheraBand tape. There's a ton out there now. Anyway, so I just kind of round out the edges so it doesn't peel up as easy. And I might make them a little bit longer too, but this is a good little kind of a treatment and an assessment, kind of a self-assessment. Brandon, what's up, bro? Anyway, so if it's on the inside of your knee, this is what I do. If it's a saphenous nerve, if you follow that thing, just look up the saphenous nerve. Anyway, so what I'm doing is I kind of have my knee at like, at least aroundish 90 to 60 degree flexion. It doesn't have to be a lot. It just doesn't work very well when your knee's completely straight. It doesn't work very well when your knee's completely bent. So maybe 90, maybe a little bit less of knee flexion, right? Anyway, so if you guys have medial knee pain, try this. Just kind of tack down the first inch of the tape, stretch out the rest of it till about the last inch of the tape, about maybe 75-ish, 50 to 75%. And along that little groove that I mentioned right there between your quad and your hammy, right here, right? There's a little bit of a groove. You'll feel that at about this degrees. You'll feel your finger just kind of go bloop right in that little area. So that's one. And then two, coming up from here, just a little bit below your knee, where that pes anserine bursitis is that people talk about, that I think is a bunch of baloney most of the time. Not all the time, but most of the time. Anyway, so right in that right after your tibia, there's a little bit of where it becomes fleshy right there. So about right there is the middle of where the tape is. Again, just kind of tack down the ends, but stretch out the middle portion. All right. And then I'll do another strip. And that little area might overlap with this thing. Sometimes one makes it feel better, two makes it feel a good bit better. And it's a good little test for you guys. Anyway, it doesn't have to be perfect. Maybe overlap at a half or so. And there's 3 strips right there that are just laid down. First one here, second one here, third one here. And it's always kind of going from the bottom kind of to the top, bottom to the top, bottom to the top, right? Okay, so you get the idea. Anyway, then walk around, see if it feels better. If it feels better, that's a good indication that it's probably a little bit on the nervy side. I'm not saying it happens all of every time, but it ends up being a pain point often. The saphenous nerve. So again, it's spelled S-A-P-H-E-N-O-U-S, saphenous nerve. And Carrie and Juliana, hey, thanks for all you guys hopping on. But anyway, so for medial knee pain, that can be, let's see, June and Marcia and Chris and Carl and all you guys. Thanks for hopping on. I appreciate your time. Anyway, go ahead and if you want, comment on this thread. If you got any questions about medial knee pain or anterior knee pain, posterior knee pain, we're going to do a series on the knee because it seems to be the hips, knees, foot and ankle, sometimes the back for runners or people just enjoy running around and not being in pain. So yeah, give that stuff a shot. Those 2, a self-assessment and a treatment tip. And if it's the saphenous nerve, both of those that I just showed you will tend to make it feel better. So if you press on the area a little bit below your knee, right, or a little bit above your knee, maybe an inch or 2 away, keep your pressure on it for maybe, 10, 15, 20 seconds. And if it's it's delayed like that. When it's a nerve, it'll be sometimes there's a delay. If it's not real bad. If it's real bad, it won't be much of a delay. But, if it's a tendon, there'll tend to be pain, every time. If it's a ligament, it'll be painful about every time. A muscle will be painful every time, you just poke on it, ow. Nerves, not all the time, particularly when they're not really strong pain points all the time. But enough to really aggravate you because it keeps showing up. So anyway, let's see if there's any other kind of questions here. Scott, thanks for hopping on. All you guys. Juan, if you're still on, I'm kind of wondering what you mean by stay there. Like for how long does it stay there, or has it stayed there? Generally a bruise won't stay there unless there's pressure on it, like I mentioned, and pretty firm pressure. Yeah, so Chris again, the nerve is S-A-P-H-E-N-O-U-S. Look that sucker up, man. It has little, and it's only a sensory nerve. It doesn't innervate muscle. It innervates the skin and the area of the skin all the way down from the femoral nerve. It ends up being a major pain point for a lot of people that, the doctors, physicians, and other people just kind of look at them and kind of, I don't know what you're talking about. MRI is negative. And, the problem with the MRI is that it's great for, when it identifies a real pathology that is a real problem clinically, and you can see it in the tests, right? But when an MRI might not see anything, number one, and you obviously still have pain, generally that's the nerve setting off pain. Okay, so let's see here. I had knee pain after a marathon, got a bruise, it healed, but it seems it stayed, the bruise. No, it's probably not in your mind, Juan. So when you say bruise, I'm thinking of black and blue. I'm thinking of color, some kind of discoloration of some sort that isn't continuous with normal skin. Yeah. So if it was an actual bruise and a color, see, that's interesting now though. So if you ended up having a bruise at that same area, and it healed, and the color went away, now it's a normal color. Yeah. So, but it seems it stayed. So the feeling of the bruise, if I get this right, this feeling of the bruise kind of stayed, but the color went away. Is that right, Juan? The feeling of the bruise, yeah, the medial part of the knee, yeah. So the feeling of the bruise, it sounds like the feeling of the bruise went away, or the color of the bruise went away, but the feeling kind of stayed. Generally, well, the feeling went away. Okay. The color stayed. Oh, that's interesting, man. Yeah, I don't. If is it a current is it a current pain point? Like, do you have pain there when you run or not? If it's one or the, if it's not, if you don't have any pain there anymore and you're fully healed, you never feel it anymore, you just see it. That was probably a really a pretty good bruise that just discolored your skin and stayed there. No more pain ever. Yeah. Generally that's a bruise, but it's interesting. Unless you kept on knocking your knees together a little bit after a marathon, you got tired and your knees were, hitting each other a lot. Yeah, generally a bruise won't show up unless there's constant pressure on it or pressure over time. But yeah, so anyways, David, good to see you, man. Hope this helped you guys. And yeah, so the saphenous nerve masks as a lot of pain points in the medial knee, the inside of the knee, meaning the inside of the knee, and the front of the knee. You see it all the time in the clinic, either just above the kneecap, below the kneecap, on the kneecap, VMO, all that stuff. But it gets caught up in a lot of diagnosing for a lot of treatment for medial knee pain when it's it's a branch of the nervous system that's completely sensory and keeps on giving people pain sometimes. So anyway, hope this helps. And Steve, thanks for hopping on. And David, love you, man. Thanks for saying hey. Linda and John, Scott, yep. All you guys, thanks for hopping on. Hope I created some value for you guys. If I did, great. And I hope I did. But if I didn't, then give me a shout and let me know how I can be helpful for maybe another live or shoot you something that might be helpful. So anyways, take care and peace to all you guys. Have a great week, and we'll talk again soon.